Wash your hands. Close the curtain, shut the door. Hello, my name is Ashley. I'm going to be your nurse for today. Can you verify your name and date of birth, first and last name?
Brianna Swift, February 7th, 2003.
Okay, can I see your armband, please? Alright, so the doctor has ordered a full physical assessment for you today, so is that okay with you?
Yes.
Alright, do you know where you are currently?
Yes.
Alright, where are you?
The doctor's office.
Do you know your current situation and what brought you here?
Yes. My finger hurts.
Do you know what today is?
Yeah, Saturday.
Alright. Your answers to the previous questions indicated that you are awake, alert, and oriented with the person, place, time, and situation. And you can document this as AAO times 4 in the neurological assessment. So, moving on, I'm going to explain to you what the Glasgow Coma scale is, and this is a scale to determine if you have any brain damage. Usually people that score an 8 or below have severe brain damage. You score between a 13 and 15, you have mild to no brain damage. So we're gonna test that by 3 things. You use your eye response, your best eye response, your best verbal response, and your best motor skill response. So moving on, what we're gonna do next is it's a hint test. It's head, eyes, ears, nose, and throat. And with that, we're gonna start off with your head. What you can notice is her head is normocephalic. She has no enlargements or deformities. And what I'm going to do is palpate her scalp to see if she has any enlargements. And she has none. So moving on, we're going to assess your ears next. Are you having any trouble hearing?
No.
Oh, and going back to the head, are you having any headaches?
No.
None in the past?
Nope.
Alright. So, do you have any excess buildup of earwax?
No.
Do you have any hearing problems?
Nope.
Do you wear any kind of device that helps you to hear?
Mm-mm.
Okay. Can you hold your head straight forward for me? You're going to look on the... Oh, wait. I need to show it from this side. You're going to follow this imaginary line from the top of the ear to the inner corner of the eye. Her ears are both symmetric and they're in alignment with her head. So we're going to move on to her eyes next. Are you having any trouble seeing?
No.
Do you know when your last eye appointment was?
No.
Okay. You probably need to go to the eye doctor. So we're going to do a Perla test. And with that, you check the pupils to see if they're equal and round, if they're reactive to light, and then you can do accommodations. We're not going to do accommodations today, but I am going to check the pupils. And I have a pen light that has an eye gauge, or pupil gauge on the side of it, so we're just going to do that and see what size our pupils are before we do see if they're reactive to light. And look at me. Okay, so I'm noticing that her pupils are slightly enlarged. They're at 6 millimeters each. They are round and equal. Can you look at me? Alright, so with this test, to see if she's reactive to light, I'm going to shine the light in her left eye. And her left eye should constrict at 100%, and her right eye should constrict at 50%. Vice versa. Ready? Mm-hmm.
Yeah.
Her left eye had good constriction while the right eye stayed at 50%. Alright, look at me.
Just trying to put her eyes out, blind her.
Okay, and her eyes seem to be reactive with light. There's a good constriction in both of them. So we're going to move on to her nose now. We're going to do a patency test. What?
Yeah, what?
Okay.
Yeah.
Sorry if y'all heard that. So we're going to check and see if her nose is in alignment with her face, and it seems to be like it's in alignment. What you're going to do now, we're going to check to see how your breathing is through your nose. Can you take one finger and put it on one nostril and blow out and breathe in with the other one?
Wait.
Push. Okay. And do that to the other side. Are you having any difficulty breathing when you do that?
No.
Alright. Do you have any excess leakage of mucus?
No.
Okay. Alright, so what I'm going to do next is assess her mouth and her throat. Her lips appear to be pink and moist, so that's a good thing. We're going to check her oral mucosa. So can you open your mouth for me? Everything seems to be in a line there. She seems to have good dental hygiene, no tooth decay, and Her oral mucosa is pink and moist. So we're gonna check out your throat now, and this is where we check to see if the trachea is within midline and if she has any trouble swallowing. Stop me mugging me. Alright, so I'm gonna give you a pretend cup of water. And you're gonna
Throw it in her face. I mean,
you're gonna pretend to swallow, and while she does that, I'm gonna palpate her trachea to see if it's within midline or if she has any trouble swallowing. Ready?
Yeah.
So, pretend to swallow. Did you have any difficulty swallowing?
No.
Anything in your throat?
No.
Okay. So, what we're gonna move on to now. Our next thing will be the cardiac and respiratory assessment. So I'm gonna listen to your heart right now. Is that okay with you?
Yeah.
Yeah. So you're gonna place the veil on the second intercostal space, and this is the aortic region. This will all be done under the shirt whenever you're doing the physical assessment. And this is on the right side. You'll move over to the left side to the second intercostal space. This is the pulmonary valve.
Oh.
Move down to the third intercostal space. This is Erb's point. And then the fourth intercostal space is the tricuspid valve. And then you're going to follow the midline of the clavicle in the fifth intercostal space. And this is the mitral valve, the point of maximum impulse. Alright. All of her heart sounds seem to be within the same rhythm. And she sounds clear, so we're going to do your respiratory assessment next. Okay?
Mm-hmm.
So, no, wrong way. You always start on the left side of the patient, but this is going to be the right upper lobe. Take a deep breath for me. Then you're going to go to the left upper lobe. And then the right lower lobe. And the left lower lobe. Now you're going to come over here to the... Oh, no, this was the left middle lobe. This is the left lower lobe. Take a deep breath. Alright, and then you're going to go to the back. You start on the left side. This is the left upper lobe. Take a deep breath.
Kirby, shut up. Stop.
Okay, her breathing seems to be clear and no labored breathing. Going back to the cardiac assessment, whenever you're assessing the mitral valve, you'll do that for a full minute. So what we're going to do now are all of your pulses, and I'm going to point out the places where you can get a pulse on any patient. So at first you have one, it's called the carotid, that's up here in the neck. And then you'll do it on the other side. You do all pulses bilaterally. You can never do these both at the same time because you'll cause your patient to pass out because lack of blood flow. And then you have one, hold your arm up, hold this arm up. You have a pulse in your axillary. Moving down, you have a brachial pulse. It's going to be on the inside with the pinky. And then moving down, this will be your radial pulse. And so far all of her pulses are a 2+, so they're within normal range. And then you have a pulse in the crease of your groin, that's the femoral pulse. You have one behind the knee, that's the popliteal. Moving on down to the foot, you have your, I forgot that one. You have your anterior tibial, so that's going to be behind the ankle. I gotta figure out what the other one is. I forgot it. Dorsalis pedis. That's gonna be on the top of the foot. So you'll follow up here. This is her dorsalis pedis, and it's the posterior tibial.
Pause.
Alright, so okay, so the next thing that we're going to do is a gastrointestinal, so it's a GI assessment. This one, you would perform it with the patient lying down, and you'll listen and feel around the abdomen, but in this case we're not going to do that. You always start in the right lower quadrant, and what you're going to do first is you listen first, you inspect first to see if everything is, in line, if there's any, the curvatures in her stomach are supposed to be there, if there's any masses, you'll check that out. But for this video's case, we're not going to, lift her shirt up and all that, but you'll listen for any sounds. And you listen in each area for 1 to 5 minutes. So you start in the right lower quadrant. And you move up to the right upper quadrant. And then the left upper quadrant. And the right lower quadrant. All of her abdominal sounds are active. So what we're going to do next is turn this around to the bill, and you'll use this to check for bruits, and you're going to check each of those sections, but I'm going to show you the part where you'll hear the bruit the most, and this is for an aortic abdominal aneurysm. It's a mouthful. So you're going to do that. You're going to go to the bottom of the xiphoid process and above the umbilicus, and you'll listen with the bell. And you'll listen to that for between 1 to 5 minutes. So next what we're going to do is I'm going to palpate her stomach to see if there's any tenderness within her stomach. You ready?
Mm-hmm.
Mm-hmm. Does it hurt?
No.
Any pain or tenderness?
No.
Alright. Can you tell me when your last bowel movement was?
Yesterday.
Alright. Are you having, so what I'm going to ask you now is about your urinary system. Are you having any trouble going to the bathroom?
No.
None at all?
No.
Alright. Are you noticing any discoloration in your urine?
Nope.
None at all? Alright, so going back up to your cardiac and respiratory, are you having any shortness of breath?
No.
Have you had any chest pains?
No.
None at all?
No.
Do you have any history of heart attack or stroke?
No.
Alright. Well, the last thing that we're going to do is a pain assessment. Do you have any pain anywhere?
Get on my finger.
On your finger? On a scale of 1 to 10, 1 being the least amount of pain and 10 being the most amount of pain that you felt in your life, what would you rate it? About a 5? Okay. Whereabouts does it hurt on your finger?
In the middle.
Is it a stabbing or is it a stabbing, burning, shooting kind of pain? Can you explain your pain? How it feels?
Yes. It's like a stabbing.
It's like a stabbing pain?
Yeah.
Okay. How long have you had this pain?
Since last night.
Alright. And then,
Pain.
yeah, pain. Okay. What makes it better or worse?
Not moving it.
Not
Makes
moving it?
better. Yeah.
Alright. So I actually forgot to do a couple of things. I have to check you for range of motion in your joints, and I have to check you for edema and your capillary refill. So can you hold out your hand for me? So we're going to check her capillary refill by pressing on her fingertips, and if the color comes back within 3 seconds, then that shows that she has good circulation within her fingers. Can you hand me that one? Alright, and while we're here, we're going to check her for edema. And you do this by squeezing, and if the skin comes back, and that shows no sign of swelling. So she's showing no signs of edema in her upper extremities. We have to do the lower extremities now. Can you?
No. I feel violated.
Just a little bit, please.
I've not shaved my legs, bro. My legs are not shaved.
You didn't give her any warning.
No.
Okay, well, this is, you would generally, you'll generally check for edema. Mama, let your pants look on.
Good luck with that. These are
So you
skinny
check
jeans.
for
They're
edema
tight.
by pressing on the leg, and you'll go from the okay. So Bree is showing no signs of edema. That's what we're gonna say. Oh goodness gracious. Okay, so we're gonna check the range of motion for 2 upper extremities and 2 lower extremities. Can you hold out your arm for me? We're gonna check your elbow. So what you're gonna do is place your hand on the joint. Can you flex? Flex. Extend. Alright, so she's gonna do this against resistance. So you're gonna flex and extend. Then we're gonna come over here and do it to this side. Flex, extend. Alright, now flex, extend. Alright, she's showing good range of motion in her elbows, and I noticed no signs of cracking or popping. Do you have any pain in your elbow joint whenever I did that?
No.
Okay. So we're gonna do your wrist next. So you're gonna flex, extend, hyperextend. Alright, now flex, push, alright, extend, hyperextend. This is really what it's gonna be like one day. Alright. So flex, extend, hyperextend, flex, extend, hyperextend. Alright, was there any pain in your joint whenever you did that?
No.
She showed no signs of popping or cracking, so she has range of motion in that. So we're gonna do your knee next. What you're gonna do is flex like that, so flex, and then extend. Alright, and now flex again, extend. Did that hurt?
No.
No pain? Alright, so we're gonna do this one, so flex, extend, and I'll flex, extend. Good deal. There's no signs of popping or cracking in either one, so we're gonna do your ankle next. Flex. This is plantar flexion, then you have dorsiflexion, so go all the way up, and then extend. Alright, so do it against resistance, so you're gonna plantar flexion, down, alright, and dorsiflexion up, and then we're gonna go on to the next one. There's no signs of popping or cracking. Stopping the free. Alright, plantar, and then dorsey. Alright, we gotta go up, go back. Okay, so she shows full range of motion in all 4 of those joints whenever I did with resistance and without resistance. There's no pain whenever she moves those. And that will conclude this video. Thank y'all.